We have discussed the important vessels and nerves of axilla. Now we will move on to the lymph nodes of axilla. Axillary lymph nodes are clinically very important because they drain the breast and they should be removed when you remove the breast for carcinoma to prevent metastasis. Now we should look into the position, draining area and the drainage of each axillary lymph node and how to palpate them. This is the pectoral region, arm, clavicle, neck, and this is the axilla. You can see the anterior axillary fold and the posterior axillary fold. Here will be the floor of the axilla, and behind the clavicle here will be the apex of the axilla. The lymph nodes are always seen along the veins of a region. This is the pectoralis minor muscle inserted to the coracoid process, and this is the axillary vein. You know it continues as the subclavian vein at the outer border of the first rib. Two tributaries of axillary vein are important when we look into the anatomy of axillary lymph nodes. One of them passes on the anterior wall of axilla along the lateral border of pectoralis minor muscle, which accompany the lateral thoracic artery. So this vein is the lateral thoracic vein, and this vein, which is seen on the posterior axillary wall, accompanies subscapular artery and called the subscapular vein. So there are 5 groups of axillary lymph nodes, and let us see one by one. The first one is the anterior axillary lymph nodes. You see it is seen along the lateral thoracic vein. So it is the main lymph node which drains the breast parenchyma, and if you want to palpate it, introduce your fingers into the axilla and palpate the anterior axillary wall, inner aspect of the anterior axillary wall. Now the next group is the posterior axillary lymph nodes seen along the subscapular vessels. It is seen on the posterior wall of the axilla over subscapularis muscle. And if you want to palpate them, you can press over to the posterior wall of the axilla and can feel for the lymph node. It drains the posterior chest wall. The next group is called the lateral axillary lymph nodes. They are seen along the medial aspect of the axillary vein at the lateral wall of the axilla. It drains the upper limb, except some lymphatics accompanying the cephalic vein, which passes along the lateral border of the upper limb. So these 3 are primary lymph nodes because they have specific drainage areas. And the next group is called central axillary lymph node. You see, it is seen in the central part of the axilla, and it is seen within the axillary pad of fat, behind the pectoralis minor muscle. The central group drains these 3 groups. So the lymph from anterior, posterior and lateral axillary lymph nodes will drain into the central group. So it is a secondary lymph node. And the most important structure which is related to central axillary lymph node is intercostobrachial nerve, and we have discussed the clinical importance of the relation. The next group is called the apical axillary lymph nodes. You see, it is seen at the apex of the axilla. It is behind the clavicle. It is seen in a space which is above the first intercostal space and below the clavicle, and it is related to the axillary vein. Apical axillary lymph nodes are tertiary group of lymph nodes. It drains the central axillary lymph node. So the lymph from the primary group of lymph node drain into the secondary group and then to the tertiary group of lymph nodes. Apart from this lymph, it also drains the upper part of the breast. So from some lymphatics from the upper part of breast drain directly to the apical lymph nodes. And also the lymph nodes draining the thumb and the lateral aspect of the upper limb accompanies the cephalic vein and directly drain into the apical lymph nodes. So if you want to palpate the lateral axillary lymph node, you have to palpate over the humerus on the lateral wall of axilla. And if you have to palpate the central axillary lymph node, push your fingers into the central part of the axilla and feel for the lymph nodes within the pad of fat. And if you want to palpate for the apical lymph nodes, push your fingers towards the apex of the axilla, place the other hand behind the clavicle and try to reach this hand with your examining fingers. So, you can palpate for the apical group of lymph nodes. So, whenever you examine breast, you have to palpate for these lymph nodes. So, if there is a carcinoma of breast and it is metastasized to anterior group alone, the prognosis will be good. And if the central groups are also enlarged, the prognosis becomes bad. And then if it is metastasized to apical lymph nodes, the prognosis becomes much worse. So these lymph nodes can also be classified into level 1, level 2 and level 3 according to their relation to the pectoralis minor muscle. So all the lymph nodes which are below the pectoralis minor are level 1 lymph nodes. So if the carcinoma metastasis to these lymph nodes, the prognosis is relatively good. Then the second group is called the level 2 lymph nodes, which are seen posterior to the or at the level of the pectoralis minor muscle. Central lymph node is a level 2 lymph node. There is another level 2 lymph node which is seen between pectoralis minor and major muscles within the anterior wall of axilla. That is also level 2 lymph nodes. Now the lymph nodes above the pectoralis minor are called level 3 lymph nodes, which is the apical lymph node. And there are some other lymph nodes here below the clavicle which are known as infraclavicular lymph nodes, and deltopectoral lymph nodes are a group of infraclavicular lymph nodes, but remember that these are all superficial to the clavipectoral fascia, whereas the apical lymph node is deep to the clavipectoral fascia. The clavipectoral fascia forms the anterior wall of axilla, and all these lymph nodes form the content of anterior wall only. So they are not grouped in axillary lymph nodes. They are not seen within the axilla. So the axillary lymph node means these 5 groups, and they can be divided clinically into level 1, level 2 and level 3 lymph nodes. Now the lymph from the apical lymph nodes then will pass on to the venous blood. See, it forms a lymph trunk known as subclavian lymph trunk and drains into the junction between internal jugular vein and subclavian vein. Sometimes it will drain into the thoracic duct on the left side. Thoracic duct is a large lymph channel which drains the abdomen and passes upwards to drain into the junction of left internal jugular and left subclavian veins. So thoracic duct is seen only on the left side. The similar lymph channel on the right side is known as right lymphatic duct. It doesn't drain the abdomen. Okay, so the subclavian lymph trunk may either drain directly into the venous channel or can drain into the thoracic duct on the left side or right lymphatic duct on the right side. So that is about the lymph nodes of the axilla. Okay.